on efficacy of this monoclonal antibody cocktail in patients with Delta virus. And the first time it has been compared to the standard of care treatment. So these are two important aspects. And you can see that now Delta virus has taken over completely all over the world. In fact, United States also 90% of the cases or more are because of Delta virus. And unfortunately, this is more infectious, it is causing more serious cases and more serious deaths. So we require immediate treatment for this. And this is to show you what happened actually in Indian context. You can see somewhere from middle of March slowly started, April and then very suddenly it peaked before even the government, even the medical fraternity could actually ensure what happened. We saw the sudden peak and so much death. That's because it is 5 to 8 times more contagious than the standard type of virus, and that's why it took over completely. And of course, somewhere in early May, we got permission in India for using this. In fact, at that time also we had a press conference where we treated 40 patients. And I told my friends in the press that we will soon do this big study to show the real efficacy, because 40 cases are not enough, and that's how we wanted to know the efficacy against the Delta virus. So we designed this study to see how it was going to be effective. And just I'll briefly tell you about the study before we go to the other things. So what we did was we took 285 high-risk patients from our fever clinic. And very important, all of them were taken within 7 days of symptom onset. This is important. These monoclonal antibodies have to be given within 3 days preferably, but also within 7 days of the onset of the disease. All the patients were RT-PCR patients, and they divided into positive patients, and they divided into two groups. One group of 208 patients got monoclonal antibody. The second group were given the standard care of treatment with remdesivir. So these are the two groups. And after that, after giving the treatment, we looked for the changes in the clinical symptoms, viral load, virus variant, repeated the RT-PCR to show the virus is there or not, and of course did all the inflammatory markers. In addition to all this, we also did what was very important was looked at the lab effect of monoclonal antibodies against the Delta virus. So you see, this is how all this was done. So it's a very, very thorough study which was designed in such a way that we can get an answer from this particular study. One of the most important things we did in this study is that we did, along with CCMB, genomic sequencing to look at what, at that point of time, nobody in India knew what was the virus causing the second wave. And the CCMB is one of the best genomic sequencing centers in the world, and they took it up, and all the patients who were done in this study were genomically sequenced to see what is the virus. And now let's look at the results. Very interesting. The results showed that 78% of the patients on monoclonal therapy improved, compared to less than 50% of the patients on standard. And standard treatment was with remdesivir, which is the best possible treatment at this point of time, compared to monoclonal, which is 78%. And then the second thing is that 75% of patients became RT-PCR negative. So by 1 week itself, the RT-PCR negative. Whereas with the standard treatment, they take much longer, usually 2 weeks to become negative. That means the virus is going off. And when we looked at the inflammatory markers, this is indication of severity of the disease. For example, ferritin, CRP, and so on. All of them were normal in the monoclonal antibody group, whereas they increased in those who had standard of care treatment as expected. None of the patients in the monoclonal antibody group progressed to severe disease, and there were no deaths. Whereas some of the patients in the standard treatment group actually went into severe disease. So that was the difference. We know that when they go into severe disease, they go into critical disease, death is there in these patients. And one other important thing is, now we are following up our patient. None of the patients who took monoclonal antibody developed post-COVID syndrome. This is again important because in the standard treatment, 30 to 40% of patients, even after treating for COVID, becoming well, developed post-COVID syndrome, which is in form of lung problems, heart problems, joint pains and all that, whereas with monoclonal did not develop. So this is an important thing. Now, after this study, we are continuing we have treated about almost 1,000 cases with monoclonal antibody with the same results, exactly the same results. The other important thing that we did was actually, this is something again which was not done earlier, and I'll ask Kishore to explain this. This was to look at how this virus is neutralized outside the body. All the tests with monoclonal antibodies till now in the world was done with viruses which are traditional viruses like Wuhan virus and all. With Delta virus, we didn't have any study. So before we started this study, we wanted to see whether it really neutralizes the virus. And we are happy that Dr. Kishore from the Institute of Life Sciences, supported by Reddy Labs, actually did this. This is again a basic science lab which has a very high facilities, and we are fortunate in Hyderabad to have institutions like this, CCMB and Life Sciences, because these things cannot be done elsewhere. They are very, very difficult things to do. This also collaborates what we did clinically, the efficacy. And you can see from the results, what we found is that if you looked at the virus concentration in people who had this cocktail compared to standard treatment, the virus concentration is decreased markedly, which is reflected in increased CT value that you can see here, decreased markedly in monoclonal antibody patients compared to the patients who choose standard of care. So when you give monoclonal, the antibody completely comes down, and sometimes by 3-4 days it becomes negative. So what is the impact of this study? I think it's very important to remember that we remember what happened at the second wave. I think we lost a lot of lives, numerous families got devastated. Unfortunately, at that point of time, we didn't have this therapy. We didn't have the knowledge of this therapy. The cost of hospitalization is very high. As you can see, you must have heard so many reports. So people ask us about the cost of this monoclonal therapy. It's costly. But if you actually look at the cost of monoclonal therapy, it is only now about 65,000 rupees, single shot, that's all. Whereas hospitalization for several days going into severity may be more costly. Hopefully some of the Indian manufacturers will take it up and the cost will come down much more. So this will benefit more patients. So I think other problem is we have large number of diabetics, hypertensives and so on. As Dr. Jagdish will agree with me, the clinician, internal medicine person, he sees these cases. We have the highest number of diabetes in the world, 77 million. So I think all these people are prone to develop serious disease. And fortunately for us, monoclonal antibodies are available to prevent this disease. And this is very important now for us that we should be very careful in treating these patients who are especially hypertensives, diabetics, heart patients. They are the ones who can go into severe disease and they can be treated. But a small, I think we have to give a small warning to all the practitioners also that this therapy should not be given to everybody.